Welcome to the deep dive. Today we're going deep inside the world of intensive care.
Mm-hmm.
But instead of focusing on all the medical equipment, which, is always impressive,
Right,
we're really looking into the systems that are in place
right.
to make sure that the sickest patients are getting the best care possible.
Absolutely.
And this is where ICU care bundles come in.
Yes, exactly.
So have you heard of these?
I have. I've heard of these. And they're actually really interesting because you're right to highlight that it's about the system.
Okay.
These bundles are checklists, really meticulously crafted checklists of best practices.
Right.
They're based on the latest scientific evidence, and they pull together years and years of experience from experts in critical care.
So instead of picturing nurses frantically wrapping patients in blankets, think of it more as
Right.
I don't know, like an instruction manual for keeping someone healthy in the most vulnerable situation.
Yes. I love that analogy. You've hit the nail on the head. That's a really good way to think about it. These bundles, they provide a really, really clear roadmap for how to navigate the complexities of the ICU. And it's all about making sure that care is consistent and high quality for every patient that comes through the door.
And we are talking about patients facing some serious stuff, right?
Absolutely.
Our source materials mentioned infections,
Yeah.
complications from being on a ventilator,
Right.
even something called delirium. So
Yeah.
it sounds pretty intense.
It is intense. The ICU is a really high-stakes environment, and the patients that end up there are often dealing with multiple health challenges all at the same time.
Yeah.
And that's exactly why these bundles are so critical. They provide this structured approach to not only preventing these issues,
Yeah.
but also managing them when they do come up.
Right.
So that's why you don't want anything slipping through the cracks, so to speak.
Okay, so let's break down what these bundles actually involve. I'm picturing like a literal bundle, like a package of life-saving interventions. What's inside?
Okay. I love how you're visualizing that. You got it. And these bundles ensure that each part of the care is addressed. So just like if you're putting something together, you're not going to open up half the instructions.
Right.
You want to see all of it.
Yes.
So let's start with one of the most crucial aspects of ICU care, and that's preventing infections.
Okay.
We're talking about infections like CIUTI, CLAB-ESI, VAP.
Oh, hold on.
Hold on.
I know we're going deep, but
Yeah,
those acronyms honestly sound like something out of like a sci-fi movie.
they do.
Can you decode those for me?
Yes, you are right. We should clarify that. CIUTI stands for catheter-associated urinary tract infection.
Okay.
CLAB-ESI, that's central line-associated bloodstream infection.
Okay.
And then VAP, that's ventilator-associated pneumonia.
Yeah.
And these are all very serious infections that can develop in the ICU.
Right.
And they have a huge impact on a patient's ability to recover.
Yeah. Those definitely sound like things that you want to avoid at all costs, especially when you're already in such a fragile state.
Exactly. And that is where the infection prevention bundles come in.
Okay.
So one of the most impactful bundles,
Yeah.
and probably the simplest, is the hand hygiene bundle.
Right.
So it might seem really obvious, but making sure that everybody, and I mean everybody, doctors, nurses, technicians, anyone who interacts with that patient, washes their hands before and after any contact with that patient.
Right.
That is absolutely fundamental.
So it's like that saying, an ounce of prevention is worth a pound of cure.
Exactly.
But in this case, it's about preventing something that could be incredibly dangerous for someone who's already in such a critical condition.
Exactly. And the evidence really does back that up.
Oh, yeah.
Studies have shown over and over that if you have good, consistent hand hygiene practices in place,
Yeah.
you can drastically reduce how often these hospital-acquired infections actually happen.
Okay, so hand washing, got it. What other infection-fighting strategies are included in these bundles?
Okay, well, let's take CLAB-SI as an example.
Okay.
So we talked about that being a central line-associated bloodstream infection.
Right.
And there's a CLAB-SI bundle. It outlines very specific steps for how to insert and maintain central line.
Okay.
So central lines, these are the catheters that are placed in large veins,
Okay.
often near the neck or the chest.
Right.
And they're essential for giving medications and fluids.
Right.
But they also create a potential way for bacteria to get into the bloodstream.
So it's like a double-edged sword. Necessary for treatment, but also potentially risky.
Exactly. And that's why the bundle is so important. It stresses how important it is to use meticulous sterile technique when you're inserting these.
Right.
It says the line needs to be assessed daily to see if it's still necessary,
Wow.
and then to remove it as soon as it's not needed anymore.
Okay.
Each step in that bundle is designed to minimize that risk of infection as much as possible.
It's amazing how much attention to detail goes into these bundles.
It really is.
It makes you realize that every single step in the ICU, no matter how small,
Yes.
can have major consequences.
Absolutely, it can. And it's not just about preventing infections.
Right.
These bundles, they address a whole bunch of critical care challenges.
Okay.
So let's move on to another really, really important area, and that's breathing.
Okay.
Many ICU patients require a little assistance with their breathing,
Right.
and that's where we bring in mechanical ventilation.
Okay, like the machines that you see in all the medical dramas.
Exactly. Exactly. Those machines,
Okay.
mechanical ventilation can be completely life-saving,
Right.
but it's not without its risks.
Right.
One of the big ones is something called ventilator-associated lung injury,
Okay.
or VAI.
Yeah. Our source material mentioned that one. It sounds like
Yes.
definitely something you don't want to add to your list of things to worry about in the ICU.
No, definitely not.
So how do they address that?
Well, that's why the protective lung ventilation bundle was developed.
Okay, so let's unpack that one.
Okay.
Protective sounds good.
Yes.
What's the strategy there? So protective lung ventilation, it's all about minimizing the potential downsides of being hooked up to a ventilator, right?
Exactly. So the bundle emphasizes strategies that we know can protect the lungs. One of the big ones is using lower tidal volumes.
Lower tidal volumes. Okay, I'm going to need a quick translation on that one. What are we talking
Yeah.
about there?
Yeah, let's break that down. So tidal volume, that's basically the amount of air that's moved in and out of the lungs with each breath. Think of it like inflating a balloon. Like you don't want to overinflate it, right? It could burst.
Right.
So similarly, when you're using these lower tidal volumes during mechanical ventilation, it actually helps to prevent overdistending and potentially damaging those really delicate air sacs in the lungs.
So it's like finding that Goldilocks zone, enough air to help with breathing, but not so much that it actually causes more harm.
Yes, exactly. That's a great way to put it. And this gentle ventilation approach, it's been shown to significantly reduce how often people get ventilator-associated lung injury. And you know what? It improves patient outcomes overall, too.
It's amazing the impact these bundles can have. It really is. It's like they've thought of everything.
Well, they've certainly tried to. And it's not just about the lungs. Our source materials also talk about how important it is to get patients moving, to mobilize them early while they're still in the ICU,
Okay.
which is where the ICU liberation bundle comes in.
Liberation. Okay, that sounds a bit dramatic. Are we talking about like a daring escape from the hospital bed?
Well, it might sound a little dramatic, but it really does highlight how important this aspect of care is in the ICU. You see, when someone's immobile for a long time,
Right.
it can be really bad for them, especially if they're already critically ill.
Okay.
We're talking muscle weakness, pressure injuries, pneumonia, even delirium can get worse.
Wow. I never would have thought that just staying still could have that many negative consequences.
It's true. Our bodies are made to move, and when we just can't, when we're stuck for a long time, all kinds of things can start to go wrong. So that's why this ICU liberation bundle really focuses on getting patients up and moving as soon as it's safe to do so.
Okay, so what does that look like in practice? I mean, are we talking about like marathon training in the ICU?
Not quite marathon training,
Yeah.
but we are talking about being a lot more proactive about movement, that's for sure. So the bundle, it kind of lays out like a step-by-step way to think about mobilization. It starts with simple things like just sitting up at the edge of the bed, then maybe progressing to standing, and then finally, if the patient's condition allows, actually getting them up and walking.
So it's really all about those baby steps, literally, that can actually make a big difference in the long run.
Yes, precisely. And the ABCDEF bundle is a really great example of this approach in action.
Okay, more acronyms. So what does ABCDEF stand for in this context?
Okay, so get ready. It's a mouthful. It stands for Assess, Prevent, and Manage Pain, both spontaneous awakening trials and spontaneous breathing trials. Choose target of sedation, delirium, assess, prevent, and manage, early mobility and exercise, and family engagement and empowerment.
Wow. Yeah, that was a mouthful.
It is. But it does a good job of really capturing those core principles of this bundle.
Right.
Because it's really about taking, that holistic approach to patient care. We're not just thinking about their physical needs, but their mental and emotional well-being too.
So we're moving beyond the purely medical aspects of care here, it sounds like.
Yes, exactly. And that brings us to the ICU humanistic bundle, which focuses very specifically on the patient's psychological and emotional needs.
Okay, this is something I'm really interested in. I mean, in a setting like the ICU, which is so intense, it's easy to forget that patients are going through a lot more than just physical ailments.
Oh, absolutely. Absolutely. The ICU, it can be such an isolating experience
Yeah.
and disorienting. I mean, imagine being hooked up to all those machines,
Yeah.
surrounded by people you don't know, often not even able to communicate effectively.
Right.
It's a lot.
Mm.
So that's why this bundle stresses things like managing pain, making sure they're getting enough sleep,
Mm-hmm.
and doing what we can to prevent delirium.
So it's about treating the whole person, not just the illness at hand.
Yes, precisely.
Mm.
So, for example, pain management. That's more than just giving someone pain medication, right? We're talking about assessing their pain regularly, using different techniques to relieve it,
Mm.
and recognizing that everybody experiences pain differently.
What about sleep? I mean, that's got to be tough in the ICU with the lights and the sounds and just, people always coming and going.
It's incredibly tough. It's a
Yeah.
huge challenge, but it's so important for them to be able to rest.
Mm.
So this bundle, the ICU Humanistic Bundle, it encourages things like, clustering all the care activities together. So you're minimizing those little interruptions and then also dimming the lights at night, even just providing earplugs and eye masks, anything that can help create a more restful environment.
Yeah, it sounds like they really have thought of everything to try to create the most healing environment possible.
Well, we try. And then there's the whole issue of preventing delirium.
Right.
Delirium, it's that state of confusion and disorientation.
Right.
It's actually pretty common in the ICU.
Is it really?
Oh, yeah. It can have a big impact on how well someone recovers.
Delirium. That sounds terrifying. What causes it?
Well, it can be a lot of things. It's often, a perfect storm of different factors all hitting at once. Medications, sleep deprivation, infections, even just the stress of being so sick.
Right, right.
So the ICU Humanistic Bundle emphasizes, again, early assessment, catching it quickly, and then figuring out how to manage it.
Mm-hmm.
And a lot of times that means using non-medication strategies. So things like reorienting the patient, reminding them where they are, providing familiar objects, encouraging family to come visit, anything we can do to make it a little less scary, a little less disorienting.
So it's almost like you're creating this sense of normalcy, some sense of connection in a situation that is anything but normal.
Exactly. Exactly. It's easy to forget, but even though our focus in the ICU is on, saving lives, making sure the body keeps functioning,
Right.
their mental and emotional state, it plays a huge part in their recovery.
It really makes you realize how interconnected everything is, the physical, the emotional, even just the environment. It's not just about treating this one illness, it's about caring for the whole person.
You've got it.
Yeah.
And that's what makes these ICU care bundles so remarkable. They take this holistic, evidence-based approach to critical care, looking at every single aspect of the patient's needs.
It's truly fascinating how much thought and research goes into developing these, but I gotta ask, are there bundles for literally every single thing that could happen in the ICU?
Well, I mean, they can't cover every single thing, but they do a pretty good job of covering some of the most common and the most critical conditions.
Okay.
Take, for instance, sepsis.
Right. Sepsis, that's a serious infection, right? I remember hearing about that when we were talking about those hospital-acquired infections.
That's right. That's right. And it's a great example because it needs quick action. You got to do something, and you got to do it fast.
Okay.
That's where the sepsis resuscitation bundle comes into play.
Resuscitation, I mean, that word it has a sense of urgency to it, What does that bundle involve?
So it's all about recognizing those telltale signs of sepsis early on and then hitting it hard with treatment, right away.
Mm-hmm.
So this bundle, it outlines these key interventions.
Okay.
Things like giving fluids quickly to get their blood pressure stable, getting them antibiotics, and monitoring their vital signs super closely, their heart rate, their blood pressure, their oxygen levels, and their blood lactate levels.
Blood lactate levels. Okay, time for another translation, Brock. What is the significance there?
You got it. Yeah, let's clarify. So lactate, it's basically a byproduct of your metabolism, right? Your cells make it when they're not getting enough oxygen.
Okay.
So when we see those lactate levels going up in the blood, it tells us that the body's tissues, they're just not getting enough oxygen.
Ah.
And in the case of sepsis, that's a major red flag.
So it's kind of like a warning signal that things are going downhill fast.
Yes, precisely.
Yeah.
And in sepsis, time is not on your side. So having a crystal clear plan of action, like what you see with the sepsis resuscitation bundle,
Right.
that can be the difference between life and death.
It sounds incredibly intense, like you would want any doctor or nurse walking into that situation to know it backwards and forwards.
Absolutely. And that brings up a really important point. These bundles, they don't work miracles on their own. They're only effective if they're used all the time by everyone the same way.
So it's not enough to just have these like checklists printed out somewhere, right? You have to make them part of the DNA of how the entire ICU operates.
Exactly. You've got to have education, training, and ongoing quality improvement. Make sure all those bundles are being used right and they're being used consistently. It's about building a culture of safety and best practices in the ICU so those interventions are just, ingrained in how care is given every minute of every day.
So it's about moving beyond individual actions to a point where those actions are part of the system.
Exactly. And the research is clear. When those bundles are implemented well, you get better outcomes for the patients. It saves lives.
That's incredible. So if you're listening to this and you or a loved one is facing an ICU stay, knowing about these bundles, even just being able to ask about them, could really make a difference.
It really could. Being informed, being engaged in your care or your loved one's care is
Hmm.
so important. You don't need to memorize every single bundle,
Right.
but just knowing that they're there and knowing that the goal is to get the absolute best care possible, that's incredibly empowering.
It's about being, not just a passive patient, but an active participant in your own healing in a way.
Exactly. And it's also important to keep in mind, these bundles, they aren't set in stone. They're constantly being updated as new research comes out and we learn more about what works best. It's a dynamic system, always evolving, always trying to improve.
That's good to know. It's reassuring to know that the whole field is always working to make things better. So we've covered a lot, from preventing infections and managing ventilation to promoting early mobilization and addressing those, mental and emotional aspects of care. But what about some of those other really important things, like preventing blood clots or keeping blood sugar levels under control? Are there bundles for those too?
You're right. We can't forget about those. And you're in luck, because there are.
Okay, let's dive into those. Tell me more. So we're talking about bundles for like beyond the big stuff, the
Right.
stuff that might not immediately come to mind when you think about like the ICU,
Yeah.
like preventing blood clots. Are there really like guidelines for that kind of thing?
Absolutely there are. So remember how we were talking about immobility being a risk factor back in the ICU?
Right.
Well, one of the other things that can happen when you're not moving around a lot is that you can get blood clots, especially in the legs. And that's called deep vein thrombosis, or DVT.
Okay. Yeah. That sounds like something else you definitely don't want to add to your list of worries.
Right.
So how do they help prevent that?
Well, the DVT prophylaxis bundle, that's all about keeping that blood flowing.
Okay.
So there are mechanical ways to do this, like using those special compression stockings.
Right.
Or those inflatable devices that like squeeze the legs every so often, to kind of mimic that natural muscle contraction that would happen if you were up and walking around.
It's like giving your circulation a helping hand,
Yeah.
literally.
Yes, exactly. And then, of course, there are medications, blood thinners, that can also help to prevent those clots from forming in the first place.
Right. Right.
So again, it's about using different approaches, bringing them all together for the best possible outcome.
Okay, that makes sense. Now, what about managing blood sugar?
Yeah.
I know that that's something that's important for people with diabetes, but how does it play into the whole ICU picture?
That is a great question. And you're right, we do tend to think about blood sugar control in the context of diabetes. But when you're in the ICU, maintaining healthy blood sugar levels is important for every patient.
Okay.
Our sources, they actually stress how important it is to keep those blood glucose levels within a specific range. Not too high and not too low.
Why is that range so important, especially in the ICU?
Well, think about it. When your body's under stress and being critically ill is like the ultimate stress test, it can really mess with your blood sugar levels.
Right.
And both high blood sugar, which we call hyperglycemia, and low blood sugar, or hypoglycemia,
Yeah.
they can actually cause serious problems. They can affect wound healing, increase the risk of infection, and they can even impact brain function.
So it's like maintaining those blood sugar levels. It's like making sure the body's engine is running smoothly, even when it's under all this stress.
You got it. That is a great way to put it. And honestly, that's just the tip of the iceberg. These bundles, they even address things like proper nutrition.
Right, because if I think about being, really sick, food is usually the last thing on my mind.
I can imagine.
Mhm.
But even when you don't feel like eating, your body still needs those nutrients to heal.
Of course, yeah.
So the ICU bundles often recommend what's called early enteral nutrition, which basically means you're giving them nutrition directly into their stomach or the small intestine
Okay.
through a feeding tube.
So it's like a direct line to get those nutrients where they need to go,
Mm.
bypassing that whole having to chew and swallow thing.
Yes, exactly. And that way, even if a patient isn't able to eat normally, their body's still getting those calories and nutrients it needs to get better.
It really is incredible how these bundles consider every single angle of what a patient's going through, from preventing those infections and managing the breathing to making sure they're getting the nutrition they need, even if they can't eat.
It's remarkable.
Yeah.
And it really does represent, I think, a fundamental shift in how we approach critical care.
Mm-hmm.
You know, these bundles, they're about so much more than just reacting to emergencies.
Right.
We're talking proactive, preventative care, addressing all of it, everything the patient might need to have the best possible chance of a full recovery.
Yeah. So we've gone deep on these ICU care bundles, what they are, how they work, why they're so important.
We have.
If someone's listening to this and they or someone they love are facing an ICU stay, what's the key thing you want them to take away from this?
I think the biggest takeaway is just to realize that these bundles exist, that they represent years and years and years of research experience, bringing together the very best of the best in terms of how to support critically ill patients.
Hmm.
Knowing that can really empower you to advocate for yourself or for your loved one.
It's about knowing that even in that environment, which can be so scary,
Absolutely.
that there are systems in place to make sure that you are getting the best possible care.
Exactly. And the ICU, it can feel so overwhelming to the patients and to the families.
Right.
But knowing that these bundles are there, that there's a plan, that there's a team of people following that plan, that can bring a lot of peace of mind in a really, really difficult time.
I love that. Well, this has been fascinating.
It has.
It really has been a fascinating dive into this kind of hidden world of critical care.
It is hidden.
And I think our listeners are probably walking away with a whole new appreciation for, just how much thought and care and planning goes into what might seem like, on the surface, really simple checklists.
They are so much more than checklists. They're really a testament to the power of what happens when you bring together, all of it, the evidence, the experience, the compassion.
I love that. Well said.
Thank you.
And for our listeners, remember, knowledge is power. So don't hesitate to ask questions, advocate for yourself or your loved ones, and stay informed. And until next time, stay curious and keep exploring the world around you.